Hello, my name is Dr. Nicholas Cohen. I'm a family physician in Cleveland, Ohio, and I'm here to share with you some tips for children with failure to thrive. Failure to thrive means that your child hasn't gained enough weight, and it's usually diagnosed in the first 2 years of life. Failure to thrive can lead to poor brain function, learning problems, as well as behavioral problems. So it's important to address failure to thrive as soon as possible. Tip number 1 is start with a visit to your doctor. Your doctor is the only person who can diagnose failure to thrive, and your doctor can evaluate the cause for failure to thrive. Your doctor may also check your child's iron levels, as often children with failure to thrive have decreased iron and require iron supplementation. Your doctor can help you come up with a plan for weight gain for your child, as well as refer you to specialists if your child has a specific problem related to failure to thrive, such as a pediatric allergist if your child has food allergies, or a gastroenterologist if your child has gastric reflux that's causing failure to thrive. Your doctor may be able to refer you to a visiting home nurse, and your doctor may also be able to provide you with information on WIC programs and temporary assistance for needy family programs. Tip number 2 is establish a weight gain goal with your doctor and buy a baby scale. When your child has failure to thrive, the plan will be to gain weight about 2 to 3 times faster than another child their age. So the goals depend on the child's age and are as follows. If your child is from 0 to 3 months old, then the catch-up growth rate should be about 60 to 90 grams per day. So your child should be gaining weight at about 60 to 90 grams per day. If your child is age 3 to 6 months, the catch-up weight gain goals are 35 to 55 grams per day. If your child is 6 to 9 months, the catch-up goals are 25 to 40 grams per day. And if your child is 1 to 3 years old, the catch-up goal is 15 to 30 grams per day. Tip number 3 is to feed your child high-calorie foods. If your child is an infant who is fed with breast milk, then it's a good idea to use a breast pump to express breast milk. Then you can add formula to increase calories to the breast milk, or a formula concentrate. If your child is formula fed, and you use a formula powder, then you can add less water to the powder. Or if your child is fed with a formula concentrate, you can add less water to the concentrate. There are also additional supplements that you can ask your doctor about to add to the formula, such as glucose polymers and fat. For older children and infants, choose calorie-dense foods for your child and foods that your child likes. Some suggestions are adding rice cereal or formula powder to pureed foods. You can also use high-calorie milk drinks instead of whole milk. You can add cheese, butter, or sour cream to vegetables. It's more important that your child is getting more calories than that your child has any specific type of food. So if your child likes the food and it's high in calories, then it will be a helpful addition to their diet if your child has failure to thrive. Tip number 4 is to limit intake of fruit juice, water, and carbonated beverages. Most juices just are empty calories, so that they take up space in your child's belly so that their appetite becomes full, but they're not high in calories that are important for growth. So you should limit juices to 4 to 8 ounces per day, and you should limit water and sodas. At meal times, it's important to feed your child solid foods before feeding liquids, because if they eat liquids first, their stomach will fill up and they won't be hungry for solid foods. Tip number 5, avoid battles over feeding and distractions during meals. So to avoid distractions, it's important to turn off the TV if that's something you are used to, so that your child can focus on eating and not get distracted by other things. And instead of force feeding your child or threatening your child or bribing your child around food, it's actually better to just use positive reinforcement. So praise your child for eating well. Tip number 6. It's important to have a feeding schedule for your child, which means regular meals. If your child is an infant up from 0 to 4 months, then he or she should be eating 8 to 12 times a day and should never go for more than 4 hours without eating something. If your child is an older infant, then 4 to 6 feedings per day is recommended. And for older children, 3 meals and 3 snacks at a scheduled time is an important thing it's an important guideline for your child's diet. Tip number 7. If your child has failure to thrive, it's important to give your child a daily multivitamin and one that contains iron and zinc during this catch-up phase of your child's growth. Tip number 8. Make sure your child's immunizations are up to date. It's important that your child gets all his or her vaccines because underweight children do have an increased chance of infections. And if your child does get sick, he or she will likely have a decreased appetite, eating less, and making your child's weight status even worse. Tip number 9 is regular follow-up. During this catch-up phase of growth, it's important to be in contact with your healthcare provider at least weekly to monthly, depending on what you both decide is appropriate. And a strong relationship with your doctor is helpful for treating failure to thrive. Tip number 7 is to believe in yourself. As a parent or a caregiver of a child with failure to thrive, there are many things you can do to help your child grow and to prevent complications from failure to thrive. So I hope these tips are helpful, and thank you for listening. Have a great day.